If you wonder about single-payer hospitals, it all starts with a goal or focus. Single-payer hospitals focus on the patient experience and operational excellence. There are some big advantages for your hospital to focus on patients along with operating excellently. I start off the presentation with a letter to hospital administrators and follow that with a 21-step program that, if executed, will create a hospital that is prepared for single-payer. On average, 1 out of 31 patients contracts a hospital-acquired infection. A HAI is clearly a defect. Not only does a hospital cause an HAI, but if the patient is unlucky enough to get infected by the hospital will charge you to eradicate it. What other industry gets paid for defects? Hospitals' average occupancy rate is 62%, yet admitted patients sometimes wait 12, 24, and even 30 hours for a bed. Hospitals face an uncertain future due to the potential of single payer with operating margins that average 2.7%. Hospitals must change how they operate, and those that don't risk insolvency. Lean Business recommends adapting the benefits of the Toyota production system, which focuses on process and customers, or in a hospital's case, patients. The movement towards a hospital production system follows a 21-step program. Execution of this program is not fast, so action is needed to initiate quickly. By adopting a system approach to process improvement, your hospital will see an increase in patient flow and a corresponding increase in profit margins. You will create a hospital that is constantly striving for perfection, just like Toyota does. This is the start of the 21-step hospital improvement program. Step 1. Start an Office of Hospital Operational Excellence. Step 2. Educate the management team on the system improvement process. Step 3. Determine goals and strategies. Step 4. Review single-payer hospital goals and strategies. Step 5. Investigate a single-payer hospital online. Step 6. Travel to Sweden to investigate single-payer hospital operations. Step 7. Start bringing in black and green belts to start ridding the hospital of slow. Step 8. Select improvement projects. Step 9. Start the build of your hospital guiding principles. Step 10. Establish the metrics that demonstrate hospital system success. Step 11. Educate employees on waste or activities a patient or insurance company would not pay for. I have identified 101 wastes in hospitals. Step 12. Select the top 5 value streams to improve. Your hospital is comprised of value streams and overhead functions. Step 13. Select value stream managers. Step 14. Investigate areas for flow and pool. Step 15. Improve the performance of each value stream. Also, it will improve safety and decrease cost. Value streams, as an example, can include every process between the patient entering and leaving the hospital. Value stream performance is important. Process performance may not be. Step 16. Standardize all processes affecting patient safety. Institute best practices. Create a human andon system that stops a process when there is a deviation from best practices, thereby mitigating HAIs. A small improvement from 3.375 to 3.5 sigma means that you damage 1 out of 44 instead of 1 out of 31 patients. Less damage to patients means less litigation costs. You can accomplish as much as a 50 to 70% decrease in litigation costs. Step 17. Document and promote the successes of focusing on value. Step 18. Start a Kata Continuous Improvement Program. 11 continuous improvement ideas per person per year, on each value stream mapped. This is a secret of Toyota's production system. Step 19. Use an industrial engineer to set up a double bin system for supplies. Minimize supplies while never running out. Step 20. Hire more black and green belts. This will ramp up the improvement effort throughout your hospital. Step 21. Select 5 or more new critical value streams to map, and so on throughout the whole hospital. Benefits include, but are not limited to, increased patient flow, the right patient at the right place at the right time, which makes patients, insurance companies, and doctors happy. Operating more efficiently increases margins, creates investment cash. Move towards perfection by trusting the employees to improve. Rid the hospital of waste. I've identified 101 hospital wastes. Ridding the hospital of waste improves performance, decreases costs, increases process quality, and focuses hospital on improvement. Prepare for single payer, increase patient, doctor, and insurance company satisfaction. The hospital now has a culture of improvement. The hospital is agile, so it can move quickly to adapt to needed changes. The hospital is robust, meaning that new healthcare laws don't cause massive disruption. The hospital is prepared for single payer. The Toyota production system integrates the full force of Toyota on achieving their goals. Use that same unity of purpose to move your hospital closer and closer to perfection. It is my job as a Lean Six Sigma Master Black Belt to guide you on this journey. There are 2 presentations following this presentation. One is on the goals and strategies of a single-payer hospital, and the second describes the features of a single-payer hospital. Features that you can apply now and others that are conditional upon medical industry changes.